Good morning, everybody. This is Walk with the Doc, August 2017. We have a great program for you today. Dr. Aggarwal, one of our neurologists, is here, and I'll introduce him in just a second. So we speak in the office a lot about statin agents helping prevent coronary artery disease. One of the things we don't necessarily focus in on, how statins can also help with cerebral vascular disease and carotid disease. And I keep hearing from patients, I'd rather die than have a stroke. So think about those kind of comments as well in terms of how we're best going to treat stroke. But atherosclerosis can occur throughout our entire body. One of the things we're doing here today is exercising to cut back on the threat of atherosclerosis, no matter where it is in our bodies. So as that is an introduction, I want to introduce directly Dr. Aggarwal, one of our board-certified neurologists, and one of his specialties is stroke.
Good morning, everyone. Thank you, Jim. How are we doing today?
Good.
Well, thanks for coming here this morning to hear my stroke rant. Stroke, as we know, is a very significant cause of disability and sickness in the communities. It has always been there, but now it has become more prominent, more talked about, because the treatment of stroke has improved, has changed so much since 2015. Earlier, stroke was considered to be an illness where patient came into the hospital, we used to do the testing, babysit them, and send them to rehab. No longer. Stroke is now a disease wherein we can improve the quality of life in our stroke patients. So what is stroke? Stroke is a disease of the brain wherein the blood supply to one half of the brain or a certain part of the brain gets blocked because of multiple causes, and I'll come to that in a second. And as a result, the cells in the brain die from the area that has its blood supply impeded. As a result, the part of the body that is controlled by that little section of the brain, as we know, this is the control room. So the part of the body that is being controlled by that little part of the brain now becomes dysfunctional. It could be in the form of paralysis or weakness in one half of the body or a certain limb. It could be difficulty in the speech. It could be blurriness of the vision, numbness in certain parts of the body. It can be presenting in the form of dizziness. So it can also sometimes present as headache when there is a bleed in the brain, but that's a different type of stroke. We will touch upon that briefly too. So what do we do when someone has a stroke? In my experience as a physician, as a neurologist for the last 6 years or so, but as a physician for last 20 years, what I have seen is when patients have stroke or stroke-like symptoms, they do two things. One, they sleep. Let me go to bed, let me take a nap, it will get better. Your arm is weak, your part of the body is numb, or the face is drooping, but we think that let us take a nap and it will get better. Second thing I have seen patients do is pour some water over it. They take a shower, drink a cup of water, hoping it would get better. It's nothing. No, please, that's not the way we should be addressing the stroke when it happens in us or in our loved ones, in our family members. The right thing to do is to call 911, go to the hospital. And why is that? We have treatments for stroke which are time limited. We have clot busting medication which is known as alteplase, which can be given as IV, which can only be given up to 4.5 hours since the symptoms occurred. The second treatment that we have is we can pull the clot out mechanically by going into your brain through the groin, sticking a wire up there, a catheter, and trying to pull the clot which is blocking that artery. Right now we have up to 7 hours and 18 minutes to pull the clot out. There are some investigational trials underway. Some have presented the data that that window can be extended, but still all these options are still going to be time limited, how much ever far we can stretch them to. So the goal that we want to know for the stroke care is be fast. That is our slogan, be fast. What does be fast stand for? B is for balance. If you or your loved one has a balance related issue. E stands for eyes, blurred vision or sudden loss of vision from one eye especially. F stands for face, if there is a twisting or drooping of the face on one side. A stands for arm, if there is a weakness in the arm on one side or the other. S stands for speech, if there is inability to speech or difficulty speaking, like slurred speech. Now, even though S is not said for swallowing, but S also stands for swallowing. If you have swallowing difficulty, you're trying to drink water or you choke. And T stands for time. Please do not waste time. If you have any of those symptoms, don't waste time, call 911. It's better for it to be a hoax that you come to the ER and you are told, no, you didn't have a stroke, go home, rather than being crippled, being paralyzed, or being weak for the rest of your life. But now this is when someone has a stroke. Can we do something so we don't have a stroke? Absolutely. And as I have trained learning, prevention is always better than cure. Why let the stroke happen? What can we do to avoid the stroke? So there are certain risk factors which cause stroke. The single biggest stroke risk factor is hypertension or high blood pressure. Second is diabetes, and when the two come together, hypertension and diabetes, that increases the risk several fold. And the third major risk factor that goes along with the other two, hypertension and diabetes, is high cholesterols. Unfortunately, our eating habits, the way we eat, we prefer to eat outside, and the food is high in salt, high in fat content. All that does not help to decrease our heart disease or stroke risk factors. So, taking good control of your blood pressure, your diabetes, if for the people who have them, and your cholesterol, and for the others who don't have these conditions, to improve, to modify your lifestyle would be the major contributor in reducing the stroke risk. Some other risk factors for stroke are smoking, which is a risk factor for almost every single disease I have read about. Family history of heart disease or a stroke. So these are some of the things which, like family history, probably we cannot control, we cannot modify this risk factor. But the other risk factors, they are modifiable and they can go a long way in preventing the occurrence of stroke in the communities. Now, I briefly talked about the hemorrhagic stroke or intracranial bleed, which can present as headache. Hypertension is also the single biggest risk factor in causing the intracranial bleeds or hemorrhagic strokes, which again is preventable, but at the same time hemorrhagic strokes have much more disability and death that they cause. So, good lifestyle, prevention of risk factors, frequently, regularly following your doctors, following their advice, those are few things which we can all do very easily to prevent our stroke risk factors. And if someone has a stroke, we ourselves, our family members, known ones, then calling 911 without waiting for the symptoms to disappear by themselves. That happens most of the time. Stroke symptoms do disappear. We call them mini strokes or transient ischemic attacks, but still going to the hospital and being told you don't have a stroke, as I said earlier, is a better option than finding it later on, oh, I should have called 911 3 hours earlier. So those are my 2 cents, and I'll be happy to take any questions. Yes, please.
Is the occurrence of a TIA an assurance that a stroke is on its way?
It's not an assurance, but yes, that is a harbinger of stroke. Your risk for having a stroke increases immediately after having a TIA, and also in the distant distant time frame, you are more prone to have a stroke.
So it's a good warning.
Yes, it is. Yes, sir.
Do women and men present differently with a stroke in terms of symptoms?
No, they don't. No, everybody with a stroke has same symptoms. Only what I have seen is the younger women in the childbearing age or premenopausal, they have a lesser risk of stroke, even though I must also say that is changing. In the last 1 year, I have seen even 20 years old coming in with strokes, real strokes, not stroke-like symptoms, real strokes. 30 years old, 40-year-old women, I have seen all of them with stroke, which is a very unfortunate development. Yes, sir.
Being on Coumadin and Plavix, will that help reduce the chances of a stroke?
That's a very good question. So, Coumadin is an anticoagulant or a blood thinner which is used mainly for cardiac patients or patients with deep venous thrombosis. Plavix is an antiplatelet medication which prevents the aggregation of platelets, which leads to formation of clot. So both these medications are helpful in preventing strokes, but not in everyone. These medications are not for everyone to take or request your doctor to prescribe. If you have certain risk factors and your doctor thinks, yes, you should be on one of them, yes, they would help prevent the strokes.
Thank you.
Thank you.